In this episode of The Founder CEO, we talk to Michael O'Neill, founder and CEO of GetWellNetwork, a personalized tech-forward approach to facilitating the treatment of healthcare patients. Michael and I talk about GetWell's inception story that involves him getting cancer, his evolution as a business leader, working with investors that believe in his mission, the challenge of the healthcare system due to misaligned incentives, the opportunities in healthcare, and the role that AI is creating in personalized healthcare for all. So please tune in. Michael and I have a dynamic conversation. Hey, Michael, it's great to have you on. I'm excited to learn more about you and your founder and CEO journey. Thanks for joining me.
Hey, Chris, thanks for having me, man. It's good to be with you.
Awesome. So I'm really curious about your founding story around the GetWell Network. So if we could start the conversation off by you telling us that story, that'd be great.
Of course. Sometimes these stories feel a little bit, did this really happen? But here's kind of how it went down for kind of me and GetWell Network. So I was doing a JD MBA at Georgetown University in DC back when I was 28. So this is back in 1999, 2000, and was surprisingly diagnosed with non-Hodgkin's lymphoma, which is a blood cancer. And so I'd spent a couple months kind of bending over with like discomfort in my classrooms, went to the student clinic 4, 5, 6, 7, 8 times, and finally ended up in the ED where they kind of knocked me out and did an upper endoscopy, which pretty much means they knock you out, put a camera down your throat, and they kind of take pictures of the inside of your stomach. And so I woke up to a crying fiance who's my wife today of 24 years, and I looked to my other side and I saw this picture on a bed tray was of the inside of my stomach and a tumor. And so they found a tumor inside of my stomach. Turned out to be cancer. Spent a lot of time in chemotherapy and surgeries and all that kind of crazy cancer club stuff. And believe it or not, it was like sketching on a napkin on my bed tray at a hospital bed at Johns Hopkins Hospital in Baltimore. The concept for GetWell Network, which was how can we make this better for hospital patients to kind of navigate their care, and kind of that was the story behind how GetWell Network kind of got started.
On this moment of like life or death, essentially, like if it had gone a little longer, what would it have been, over? Like how close was it to?
Yeah, it's interesting. I've been involved, in a lot of leukemia, lymphoma kind of research and stuff since I went through my experience, and thankfully, the precise diagnosis I had, which was large B-cell non-Hodgkin's lymphoma, back in 99, 2000, there was about a 50-50 chance that the chemotherapy would work, and today it's actually over 90%. So thank God the medicine and the science is advancing. But yeah, back then, if I hadn't taken control of my own health journey and kept digging and scratching and digging and clawing, saying, hey, like, I know you're telling me this is a law school ulcer, but I'm not that stressed. Something else is happening and my body is raging, inside. And I think like that was the fundamental, honestly, like aha, an idea behind Get Well was, hey, help people take a more active role in their health journey. Because if you don't, it can have, of course, like both catastrophic consequences, which it could have had for me. And also, look, our human potential is like inextricably tied to our health and well-being. And so like, but yeah, it could have gone really south if we didn't keep pecking away at it to find out what was going on.
So transitioning to you realizing that there's some serious shortfalls in the experience of healthcare. This led to GetWell. What exactly does GetWell do?
Yeah, so we essentially create what the healthcare industry would call patient engagement software, and so we work with large health systems across the world. In fact, in the United States, Canada, New Zealand, Australia did a bunch of work in the Middle East as well. And we actually help large healthcare organizations deploy digital solutions so that their patients are more connected to their care. They adhere more to their care plans. They are happier with their care. They are more connected to their physicians and their nurses. And so we would be like the last inch experience. So patient holding their phone, preparing to have a baby or preparing to have knee surgery or getting their chemotherapy. And we're the ones kind of there saying, hey, do I eat food now? Do I stop eating or can I drink this? And so we just really help patients navigate, through their care journeys, if you will. It's kind of what GetWell Network does for a living.
Okay, so diving into like the industry a little bit, there seems to be, I mean, I don't know the numbers exactly, but there's a supply demand issue with personnel inside of the healthcare industry. So is
Totally.
this an element of alleviating that aspect of the industry right now?
Yeah, I would say there's kind of like three core kind of value propositions. So like first and foremost, every healthcare organization on the planet needs to actually attract patients and then keep patients in order to kind of be successful in their business. And so GetWell Network fundamentally helps them deliver exceptional, highly personalized, dynamic, digital first patient experiences. So patients want to get cared for them there and they want to keep them there at the organization to drive business, you know? And so like one, it's about patient experience and patient loyalty. On the same at the same time, you can imagine the more active, engaged, involved the patient is, the more efficient the care team can actually be. And so, to your push, yeah, look, there's a shortage of capacity with both physicians and nurses that our tools oftentimes help really accelerate and help facilitate efficiency in how care can be delivered. And then the third thing really is, you know, the business of healthcare is complicated, and we're trying to move organizations to kind of taking on more risk and driving towards what they call value-based care. And so we run a lot at populations. We have a maternal health equity program that runs at new moms who are on Medicaid, and we can really help them have a healthier, experience from a mom and baby standpoint. And we're running at youth mental health work as well. So like a lot of like population work to really help some of these target populations have better outcomes.
What percentage of these healthcare systems are utilizing get well type of technology and services?
So we work across probably 200 or so kind of enterprise clients. We're touching about 12 and a half to 15 million kind of unique patients a year, working across probably a couple thousand kind of sites of care, a combination of hospitals and clinics and all, and communities. So I'd say probably, you know, 5 to 10% of the patients are touching our stuff, in a given year.
Wow. That's, you're saying get well specifically or technology like get well
Yeah, get well specifically in the certain segments that we would
that
be
you play in?
competing, if you will. Yeah, and I mean
Okay.
we have about 50 million kind of digital interactions a year with people. So you can imagine that's like a very intimate and continual thing that we're doing on behalf of these large organizations.
And so you saw this opportunity. What percentage of the healthcare systems are still way behind in regard to providing these type of streamlined services?
Man, I will tell you, man, if you've been to a doctor in the last 12 months or someone in your family has been, uh, you would probably uh, know what I'm going to say, which is far too many of them are thinking about patient engagement as an amenity, or an extra, not a core strategic, imperative for actually delivering, the highest quality, highly personalized, efficient care. And so they're moving a direction, thankfully. And we're trying to break down the walls of adoption by proving that these solutions aren't just nice to have, but they actually really are fundamental, both clinical and business drivers for an organization. So we're starting to see adoption really kind of pick up, but it's not been an overnight success. It's been a journey.
What's the biggest snag with utilizing these types of technology and services? Is it a commitment to legacy relationships? Is it like,
Yeah, it's a good question. I think that yeah, a lot of what's gone on is there's such a complex technical environment too in these organizations. And these are a lot of big legacy systems, from their electronic health record systems to their marketing systems, to their, ERPs and their kind of, the operational kind of systems. And so it's a high priority and a real competition for both mind share and share of wallet to do things that are really on the front end of, true kind of consumer engagement. But they're really starting to wake up. We're seeing some just like outsized like impacts and results on like targeted programs. And so we're starting to see a bunch of these kind of barriers come down, but those would be some big barriers for sure.
okay. I'm going to pivot to you specifically. Obviously, your role has changed quite a bit. You've been running Get Well Network for 24 years, correct? Plus.
Yes.
So you, the founder CEO, year 1 to 5 to 10 to 24. is vastly different. Could you tell me
Yeah.
about this journey and then maybe moments throughout this journey that made you realize you had to evolve?
Of course, yeah. I'll give you an early one. So, hey, man, there's those of us who, and you're one of them, that kind of spend, our kind of time and whatever limited talent, in my case, that I actually have, being entrepreneurs and starting something, it's cherished. It's hard, but it's kind of cherished. So we spend our time really thinking about, at the core, like what is our purpose, both in life and in work, and let's kind of run, towards that purpose with the confidence that we're going to be able to get over a bunch of like obstacles and like weird things kind of thrown in our way. So I'll just give you an example early on as a founder. And so we're probably, I don't know, so we raised $1 million in 2000, our first $1 million from friends and family. And that $1 million, we didn't raise another dime until 2004. So picture $1 million lasting, 4 years, with a
Hmm.
staff of like 5 to 8 people. And so I remember vividly, we had a little tiny office. It was 3423 and a half street. You can imagine in Georgetown how tiny, this office space was. So on a given Thursday, I look over to my COO, this guy, Jeff Cuff, my founding partner. I said, Jeff, how much money do we have in the account? He's like, $9,600. I'm like, what's payroll? He's like, 11,000. I'm like, let's all go to lunch. So like, there's 5 of us at the company at the time. We go to get cheesesteaks, and we're literally going around the table. I'm like, hey Jeff, do you have to get paid tomorrow? He's like, no, I think I'm good. I'm like, okay, you're out. I'm like, Leah, how about you? She's like, look, man, like I have 2 more weeks left on my Accenture, severance. I'm like, oh, cool. So then you're good. I'm like, Gino, and he's like, dude, my wife's having a baby. I'm like, no, it's fine. I'm like, we'll pay you. I'm asking you if you got to get paid. He's like, we would literally be like going around a table, deciding together who needed a paycheck, who didn't. So like these stories that sound cliche, man, as you probably know, Chris, like they're real and they really cement a lot of things. And in fact, 3 out of those 5 people are still here today. One's our CTO,
20 years
one runs
later.
yeah, one runs implementation, and so it's like those kind of like journey moments you never forget as a founder. It gives you this unbelievable gratitude, for people that believed in you enough where they had no reason really to believe that you could make this happen. And so you're grounded in this kind of these two emotions of both hope and gratitude, both of which have been proven to be sciences that if you actually latch on to these things, understand them, they really carry you through. Now, fast forwarding to today, it's different. We went through a pretty typical A, B, and C round of venture capital. We raised $20 million of venture capital in 2004, 2007, 2009. And then we sold the business to a large private equity firm in 2013 called Welsh Carson in New York, and then sold it again 5 years later to another private equity firm. And so when you go through these milestones and these recapitalizations as an entrepreneur, if you're in a venture backed business, yeah, your role changes a lot. You get an incredibly healthy dose of, hey, here's how we do things here.
Hmm.
We love your great stories about buying cheesesteaks, but like, here's the operational KPIs that we're going to hold you to account on. And if you can't hold to account on them, we have 4 other CEOs that can do your job for you. So it becomes just a very interesting kind of evolution of like how you lead, through all these kind of different kind of phases.
Yeah, actually, I had interviewed someone a couple weeks ago, and they said people have attempted to replace them from their jobs. So this is an experience that you've had. What was that like?
It's uncomfortable, but I will tell you, it also like allows you to double down, on your values as a founder. I've said to all of our investors all along, hey, believe me, the moment that I believe somebody else in the world is better to actually both grow and have the impact that this company has actually been built to have, in this seat, I'll be the first one to tell you. And I'm sure if you think that, you'll be the first one to tell me. And let's just make sure that we're communicating on that level. In the meantime, let me kind of just be clear. There are a lot of things that are optional, and that's around like evolving strategies and where we invest and like that. I'm like, but at the end of the day, the mission doesn't change. Help people take a more active role in the health journey. Like that's what we are here to do. And two, for us at Get Well, culture might eat strategy for breakfast, but like values sit at the dinner table. And in our world, and I mean this, man, it's like number one, root for each other. Number two, share openly and honestly. Number three, be world class every day. Number four, find strength in our differences. And when it doesn't matter who the investor is, like that is always like where I lead from quite explicitly. And if those things don't match, then this probably isn't going to be a good fit. And so like there is an opportunity even through these moments to kind of really stay true, to kind of both mission and values. And those fundamental things for us have been like great centering forces for a very long time. And it's worked very well for us.
And so that's something that sounds like it's been a constant for 24 years. But that said, a PE company, you would have to change or improve, evolve and improve certain other skill sets to keep that job. What were some of the skill sets that you would improve on to,
Yeah, the
keep
main
the job?
thing is like a lot of us as founders, we made our businesses successful and survive early on almost through instinct and passion. Like these like two things are like the fundamental elements of how like, hey, I've got a passion for this thing. It's unwavering and you're not gonna knock me off course, even though it's gonna get thrown in my face 45,000 times. I get 45,000 no's and two yeses, but I'm riding the yeses because I believe so much in this, and we used our instincts to actually make like really key decisions. The fundamental change as businesses grow and outside investment comes in is that you have to move from like a personality based to a commitment and like data based decision making, and so like my biggest learning, was not trusting my instincts blindly, but actually using a lot of data from multiple different sources and data inputs to then still use my judgment, but it can't just be on your instinct. It has to really be driven, by a lot of data. And so like, it's been like, I guess like the macro change has been that kind of evolution, over time for me, for sure.
How about talent and surrounding yourself with other people? How has that skill set grown? Because you hear people talk about like this person's the right at this stage, but they're not right at that stage. To the same vein of founders becoming the CEO and staying the CEO. How's that experience been of realizing how people fit inside of the organization?
Man, I was just going to say that same thing you just said. I picture this a combination of a bullseye target and a relay race. And so when you're starting a company, you're at the middle of so it's a little tiny circle, and to me, like you better be hiring people, in my experience, that quite honestly have very different skill sets than you, because there aren't enough people to go around to actually get the work done. So if you're great at marketing, if your instincts are marketing, then you can't afford another marketing person. You better hire an operations person, a technical person, or what have you.
Hmm.
But then all of a sudden, like your job as a founder CEO is to anticipate the leap to like the next like concentric circle in that target that's wider and wider. And oftentimes, quite honestly, the athletes that are running that current lap of the race, as amazing as they are, they won't be successful either in their current roles or in the organization at all, in that next lap. And I think like the fundamental like understanding, staying close to it, and anticipating where your strategy and talent needs are going to dictate, how adept that we are as founder CEOs to kind of move that talent in advance of those leaps. Because when you're late on those things, and all of a sudden you're caught with the wrong chief technology officer or the wrong head of sales, or the wrong CFO, it's a really painful track. None of my peers that I speak to all the time have ever said, "Hey, I think I made that move too quickly." It is that's a rare statement when it comes to talent. It's usually about, man, I waited 6 months or 9 months or 15 months, and now we're so far behind, and I've really made a mistake not making a move. That I knew was right. And these things are hard. These are people you really care about and you love, but it's not good for them either. If they're also find themselves in a spot where like they're not feeling the best version of themselves. So that would be like one of the biggest things that I've messed up a lot along the way, and gotten some things right as well.
Coming back to investors and balancing founder CEO styles, like innovation versus commercialization. So like the right time to push a product out to market versus to continue to innovate. Have you had that experience where there was I don't know, conflict might be too strong of a word, but just opposing viewpoints on when to stop innovating
Yeah,
and start
no,
commercializing?
not too strong of a word, and you'll probably get me in trouble on this thing with a bunch of my previous and probably future investors. But look, I actually think that as you get up the stack, from early stage venture capital, to late stage venture capital, to private equity, you know, I think that there's a real lack of talent around a table that's actually focused on innovation, and a lack of focus, a lack of talent, and a lack of investment in innovation. I think that there's incredible financial engineering as you get later stage. But honestly, like the world's moving so fast and the customer demands are evolving so rapidly because of their pressures that I actually think that in later stages, it's too often that companies are acquired by firms, whose 98% of their energy, talent, instincts, data, is around financial engineering, kind of where to cut, and not innovation as a lane, as an avenue for growth. And I think I think it's a miss, to be honest with you. And so in my world, like I'm actually constantly seeking, investor partners that if they don't have it, at least they have an appreciation for it, because there is a lot of conflict in this. I'll be off saying, hey, here's where I think the market is going. I'm reading this data from the White House, for example, on Black maternal health. And I actually, like, our country should be so appalled that just because the color of your skin doesn't matter your socioeconomic status, your color of your skin is dictating whether or not you're gonna live as a new mom or your baby's gonna be healthy. And so when I look at this kind of data in my world, I'm like, well, hey, we're gonna run at that. We're gonna point our AI, we're gonna point our digital tools, we're gonna point our talent at running at solving this. And now now they're gonna say to me, hey, that's wonderful. Like, where's the money? Like, well, here's the Medicaid spend, when our Black and brown moms are not healthy. So the dollars are massive. So it is our jobs as entrepreneurs to tie both the innovation instincts you have and strategies with, of course, like commercial success, or else you can't build and run the company. But I would be one of those CEOs that would be leaning in, you know, uh, to those innovation things and pushing pretty hard at the board level and with our team to run at purpose-driven, complex, healthcare-related, challenges that the industry has not been able to solve in its current siloed format, because the dollars are so massive and the purpose is unmistakable. So like that, but this is a constant thing that we're running at and balancing.
Yeah, let's. This is a good segue into the overall health industry. That's actually a stat I've come across before. It's the mortality rates of Black women being much higher than other demographics. What are some other huge shortfalls that you see in the healthcare system?
Yeah, I think like one of the big ones, honestly, it's like look, during COVID with all the horribleness that kind of happened, one thing that was exposed, was the inequities, that are really deeply rooted, in our health system, and they actually begin with trust, and the trust of historically underserved communities, if you will. And they're underserved because the system hasn't served them, practically. They want to be healthy, just like everybody else wants to be healthy, So I think so one of the kind of things that I think the industry is waking up to and is really leaning into now, like beyond the headlines and the PR, is like, hey, like we actually have tools today that are very ubiquitous, like SMS texting. Like we actually have tools that are in everybody's hands that can help us increase access to high quality care to people in very rural communities, to people in highly urban communities that are historically underserved, and poor, and so like I think like one of the biggest issues in healthcare that got uncovered a lot, and the data again is both horrifying for a country as wealthy and advanced as ours is, but also there's opportunity that's so ripe because they are ubiquitous technologies that can be deployed at scale, cost efficiently, that can really kind of change the care. So that'd be like one area where I think there's a lot of opportunity to kind of lean in and to create some change.
What I'm gonna preface this, but like, is it rooted in the kind of like historical call it racism of these people, or is
No, well,
it
no, it's actually rooted in the financial model of healthcare in the U.S. Man, it's like it's complicated and it's challenging. But to describe it simply, you have the ultimate payer is the government, right? The ultimate payer. You have then very large managed care companies that actually like win those government contracts. Then you actually have providers, who are trying to run a business at a very low margin, where if the reimbursement rate from a payer is lower for a Medicaid patient than it actually is for a commercial insurance, patient, like there's a propensity, as you would expect, for the provider to be marketing and providing services for the higher reimbursable patient,
Yeah.
and so like the financial model has created um
An incentive
a
to provide shitty services.
yeah or no services,
Yeah. Okay.
to certain people where reimbursements are lower or non-existent, right? And so it's like
So,
so that's what's happening,
okay. Is it like too many middlemen at that
Yeah,
upper spot?
I think the incentives are multi-layered, and so it creates this odd behavior, and it's not like with malintent. Like everybody I've ever met in healthcare, honestly, like these people are so committed to providing exceptional care to everybody they kind of come across. But the business of care is complicated, where like are you proactively going out, to find, for example, people that are homeless in a community who actually really need care, even though you can't get reimbursed for them. Your reimbursement is going to be a lot lower from them. You know what I mean? So like there's this crazy kind of setup in the way that the money flows. Where I think historically in our country we've been a little bit off on how to align public health with the business of health, and it's a hard thing. It's complicated.
So is it fair to say you're much more confident in solutions that GetWell Network provides to improve care than the system being changed um, in the way you were just
uh,
kind of like,
I think that I'm more confident in GetWell Network's ability to run with speed, at some of those changes that we'd like to see. Um, uh, the good news is these are again well-intended people all the way up at the federal level and at the state level, and in all facets of the ecosystem. And so like we're seeing like some pretty encouraging traction, around a couple of these things that I would say 10 years ago we saw no traction in.
okay, good, that's good. Um, how about artificial intelligence? Obviously, it's always being talked about, but how does it play into GetWell, and how does it play into the industry as a whole?
Yeah, so it's funny, man. So industry as a whole, first of all, healthcare is one of these areas where AI is going to is being met with like one eyebrow up, like whoa, like is that scary? And the other eyebrow being like, hey, you better lean in because it can really have a transformative impact again on access of care, quality of care, equity of care. Like there's a huge, possibilities in this. At the same time, it's healthcare, so it's highly personal, with a lot of data and a lot of like judgment required, to make sure that the nuance of a person's like human existence and their health is being actually, candidly guided the right way, by the clinicians and the healthcare system. And so there's like this dichotomy of like, a hesitation, but like an acknowledgement and an adoption that's pretty exciting to say, hey, like this could be transformative for this industry that has struggled for a long time with things like access and quality at scale, and equity and all. So I think there's like an interesting kind of paradox happening right now. Number one. Number two, I think that it's inevitable that healthcare will be one of the key industries where AI has the most transformative impact. Not in the next decade, in the next literally like 12 to 24 to 36 months. And we're seeing like beginnings of this kind of already,
Can you give some
and things
examples?
like, yeah, so an example would actually be, let's go back to my initial story on oncology. So when I had cancer, there was a very common, non-nuanced chemotherapy regimen that anybody with this diagnosis actually would get prescribed. And it was a cocktail of four really nasty medicines. They'd pump them into your veins for 8 hours a day, every 21 days, and you hope that the thing would work. And you have all different kinds of side effects and different things kind of happening without it. What AI is actually beginning to empower are like dynamic, almost in real time, like highly personalized protocols based on a whole complex set of your blood chemistry, the disease state you're actually in. And so, like as an example, like you're like this notion of like precision medicine is real. You
Right.
really begin to see and you already are, like highly personalized protocols and plans of care, whereas in the past they're very generic.
Okay.
And I think
It
that's
was
like
just based
very
off like,
promising.
yeah, high level data like demographic, age, race,
E-
sex, etc.
Exactly.
And so now it goes
Exactly.
down to the, would you call it the DNA level to understand
Yeah.
what
Yeah.
to give you?
That's where this is, where it's all heading, and then I think secondly, and where Get Well plays a role, like we think about Get Well as the precision engagement analog to precision medicine. So when we think
Okay.
about AI, it's the more precise the care plan gets is actually developed for you specifically. Quite honestly, the more responsibility that you as an individual have to take on to actually follow it, and so like the
You're the
precision
facilitator
engagement.
of the treatment.
Exactly, because
Yeah.
a lot of the bad outcomes that we see in healthcare are not because the protocol is wrong. It's because the patient's either willingness, capacity to follow it doesn't happen. You know what I mean?
Yeah.
You eat the wrong foods, you don't follow through on your whatever the things are, and so for us, we're using AI today to get much more precise in how we reach out to the patient, what language we speak to them in, what modality that they're most adept at kind of taking the information in the directions kind of from, how to escalate when they get off track quicker, who we kind of gather around them on a care team to kind of support them in their journey. So all the engagement parts of like staying healthy, or following your plan is where Get Well will be using AI to kind of do precision engagement.
So this precision healthcare, is it at the stage where it's fairly expensive now, and then, in 5 years it'll be more of a mass market thing?
It is incredibly expensive now. That goes right back to the equity question. Like, what are the business models of the future that
Hmm.
allow for some of these incredible advancements, in medicine using AI? How do you make sure you can get them to the masses? Like this is like one of the big challenges, as like in the healthcare industry in general. So yeah, I think that both the cost of these things will come down over time, and there will be some like fairly innovative business models that are developed to allow some of these things to be unlocked, to more and more people.
Okay. How about the concept of like living for 100, 150 years, 200 years, through biology, engineering, how realistic do you think that is? How far off?
So two things on this. One, let's take it in two stages. So living healthy to 100 um, should be and can be done today. So I don't know if you've read all his work on blue zones and some of
Yeah.
Dr. Mark Hyman's work on functional medicine, but what I'm reading about, seeing, and trying to embed both in my personal life and in our work is this notion of like, look, the model is pretty straightforward: sleep, exercise, nutrition, mindfulness, human connection, purpose. Like this paradigm has made me at 53 feel more healthy, happy, and whole than I've ever felt in my life, despite all of the craziness happening in the world, despite pressures with my teenage daughters, despite pressures in our business. Um, and so what we're seeing in some of the research and these models, these functional medicine models, is if we actually create a paradigm and get a little bit selfish about our own well-being and put that first, on a daily basis, I think that living healthy through 100 is in our reach today, um,
For the average person,
for the average person.
if they practice those things.
Exactly, if they
Yeah.
practice them. And
Yeah.
that's both a mindset, but it can be democratized. It's not terribly expensive. It's just an understanding, and a mindset shift, um, to actually being selfish, believe it or not. Like if that first 90 minutes of every one of our days is like really self-centered, like I'm actually going to get my nutrition, exercise, mindfulness, and connection in, so then I can move towards purpose for the rest of the day. Like man, oh man, my energy is limitless. As long as I refuel it, every day with that kind of regimen. I think it's available today. This notion of going from healthy 100 to a healthy 300 is, I believe, a lot more of some of the stuff you were alluding to. Is like some of the core science, and kind of DNA re-engineering, and all kind of things
Yeah.
that folks are working on right now. That candidly, in my business and in my life, like I'm not attuned to that level, because I feel like we have so much work to do in the next day, week, month, year, and decade to help millions of people kind of manifest into the best versions of themselves through the lens of their health and well-being. And I think we have a chance to do that immediately, without some of that will happen downstream.
Okay, awesome. That's awesome. Well, it was great talking to you, Michael. I appreciate you sharing your insights and your journey as a founder CEO. Good stuff. All the best in taking the next steps with GetWell.